Welcome everyone to our publication series Innovation in Focus, European Radiology. My name is Konstantin Nicolaou and I'm with Freddie Gallagher here as one of our experts. Today we're discussing new technologies that are being highlighted in this new publication series. And we always want to include our neighboring fields like nuclear medicine. One of the papers that you can read is on new PET tracers in nuclear medicine. I'm getting lost a little bit. It's great to see that nuclear medicine is moving quickly and innovations and so many new tracers, but I'm getting lost in the know of tracers. Can you explain which ones are the highlights for you and why?
Great. Well, thank you very much, Konstantin. So this paper helps to answer that question. It's from Barwick and colleagues, expanding on the new tracers that are available. And as you say, we have very close relationships with nuclear medicine. It's love to maybe to see that harmony that is developing. And you asked which ones might be suitable for the future. Well, we use a lot of labeled glucose, FTG. The vast majority of what we do in PET imaging is FTG, but there's some very new kids in the block which are exciting. FAPI PET, for example, to look at fibroblasts, is an exciting way of looking at tumors, from differentiating tumors, identifying tumors that maybe are not FTG, I bet. In addition to that, we see raw FAPI PET and fibrosis and elimination. But beyond that, there were many tracers that are very exciting. We can see tracers looking at amino in the temples, doing brain tumors, for example. Maybe we'll set up specific tracers called estrogen receptor positive tumors.
Right. So that sounds like maybe we can also guide therapies by imaging because if you know the specific molecules showing two methodologies. Everybody's talking about theranostics and new concepts of how to do this. How do the new tracers help us in guided therapies and even having integrated concepts that we call theranostics?
So that's a great question, a very topical one. These tracers are allowing us to look at heterogeneity across the body and between patients, so we can identify which patients might respond to therapy. And ultimately, they're needing us to develop new theranostic agents. So we have a companion imaging biomarker that runs with a therapeutic agent targeted molecular radiotherapy. So we're targeting the radiotherapy to the tumor, to the cell of interest, rather than globally and damaging lung tissue. A very exciting area for the future of radiology, you might say.
Absolutely. So that shows that reading the series will teach you not only radiology, but also nuclear medicine, an adjacent and friendly field to ours. Thank you so much for listening and thank you for the discussion.
Thank you.